Hi there. This unit focuses on donning and doffing of sterile gloves. As a starter, donning is the process of putting on gloves, and doffing is the process of removing soiled gloves. So the first thing we have to consider when we're about to put gloves on, especially sterile gloves, is what exactly are we about to do? Is it a clean technique, an aseptic technique, or a sterile technique? Determine the need for actual sterile gloves. After you've determined the need for sterile gloves, you will need to gather your equipment and make sure that you set up everything in a manner that you'll be able to have the best time management and maintenance of aseptic techniques. You have to make sure you avoid cross-contamination. So when you have your gloves, you want to make sure you examine the package. Is the package torn? Is it wet? You want to pay attention to the expiry date. Is it within its expiry date? All these things determine the sterility of this glove. Next, you note the arrow that says open here. From time to time, you may see our colleagues do something like this to get the gloves open. Now, whether that tear is successful or not, you've contaminated the inner pocket of this glove. Sterile gloves come with the external packet and the internal. The external is dirty. The internal is clean. If you've torn it, you've made contact with this internal package. Therefore, it is no longer viable for a sterile technique. So we follow that arrow. That arrow leads you to where the glove opens and tears apart. We pull open the material and pour out the content, disposing of our outer packet. Then you make contact gently as possible without touching the surface, because at this point we would have been putting this on a sterile pack or a sterile field. You open the glove with minimal contact, trying not to touch the glove itself. Now, we just finished with hand washing technique, so your hands are clean, but they're not sterile. You want to start from the outer end of your dominant hand. So you're putting your hand on the outer end, slipping that same portion which your dominant hand would touch. That would then be your clean portion of your glove. You slide on your glove and straighten the neck. That dons your dominant hand. Now your non-dominant hand, you're going to push your hand in on this side. The outer portion of the glove is the sterile. So sterile against sterile. And this is how you are going to guide your non-dominant hand in the glove. Come down and you straighten the neck of the glove. This is where you've donned your glove. You do not want your hands to fall below the level of your waist once you've donned sterile glove. Anything below your waist is considered contaminated. Now, after you've finished your procedure, your hands are now dirty because you've done your dressing or you've done whatever procedure you've been doing. So now let's pretend that these gloves have blood on them. I don't want that blood to touch my skin because that puts me in danger. So I'm going to pinch dirty against dirty, pull it away from my skin, pull my hand into a fist, and take the glove off. Now I'm clean against clean, roll that into a fist and make everything into a nice ball. And then we toss that into the trash. So now we have donned and doffed our sterile glove. If you have any questions, we can discuss it right after this video.